Welcome, everyone. It's really great to have all of you here. I am Vanessa Cruvinel. I am professor at the University of Brasilia in Brazil, and I also am a board member of WHWB. So welcome. The webinar today is about COVID-19 and workers in the informal economy lessons from Latin America. So today we have two speakers. The first one is Dr. Gary Aikman. She assumed her role as Unit Chief of Health Promotion and Social Determinants in May 2018 at the headquarters of PAHO, WHO. In her current role, Dr. Gary is leading the regional renewal of health promotion in collaboration with national, subnational, and local governments to strengthen public health in the region of the Americas and strengthening the organization's focus on addressing social determinants of health. She has played a key role in developing guidance documents related to populations in situations of vulnerability as related to COVID-19. So welcome, Dr. Gary Aikman, and thank you a lot for your kindness to present this webinar. So the word is with you.
Well, thank you very much. It's a real pleasure, colleagues, to see many of you that I know from the past, and many new faces also. Thanks, Susan, very much for having me here. She was operational in doing this. So yes, I'm going to give a presentation probably a bit beyond Latin America, looking at the Americas. And just to know that although I am now 3 years in this job in PAHO headquarters, I've been with PAHO and WHO for almost 30 years, of which several years in WHO Geneva as head of the occupational health program. So again, occupational health is part of my portfolio here, and I'm very happy to be here with you and share some ideas and pose some questions, because I think, you know, this is one of the things now that we have a lot of questions and not necessarily all the answers. So I think my title is probably a little ambitious. I'm going to see how far we can go with this, but taking stock and moving forward, some reflections on occupational health in times of COVID. So of course we have to talk about, you know, what's the situation at this point. And unfortunately, as you can see in the bars on the right, the Americas have been almost from the beginning the epicenter of the pandemic. We have now a situation, and you'll see that in the next slide clearer, where we have the cumulative cases, almost 60 million, this is from yesterday, in this region, and almost 1.5 million deaths. Now, there are 2 countries or 3 countries that are really driving this in the region, and we all know which they are. It's the country where I'm in now, the US, and it is Brazil, but also countries like Mexico and some others, and Peru have been very, very hard hit. But the big numbers, the numbers that put this region at the global level in the forefront, unfortunately, come from those 2 countries. But when COVID came here, the socioeconomic context of this region was already problematic. The growth was not, there was not a lot of growth. And so, of course, with COVID coming, you know, this totally changed the panorama. But COVID found this region as the most unequal, most inequitable region in the world. 80% of our population lives in cities. We have an informal economy of over 50%, and even some countries go 70 to 90% of workers in the informal economy. So this is a region very much characterized by exclusion. And COVID, of course, has magnified, has put a loop on all those inequities and inequalities, but they have also deepened them. And one of the latest data coming out of World Bank and CEPAL is that this region has lost 14 years when it comes to poverty reduction. We are back to the level of 2006. And these are things that take long time to recover. So I'll gonna come back on that a bit because that context is important. So early on in the pandemic, almost, a little bit less than a year ago, we asked some questions about why the implementation of the non-pharmacological measures, public health measures, was not more effective than we hoped them to be. Staying at home, physical distancing, washing hands, etc. And how were the social, economic, and cultural political contexts considered when we formulated and implemented and adapted those measures, and how were those negative consequences of the application of the measures mitigated? And we all know, people losing jobs, schools closed, kids without education, people losing their income, etc. And again, I'm going to talk a bit more about that. And how was that heterogeneity of the needs of those different social groups considered in the implementation of the measures? So then we talked about the perspective of populations in situations of vulnerability or in vulnerable conditions. It makes particularly relevant to the pandemic. The example that we always give, and it's the most simple one, but of course it's a very complex issue, is if you tell people to wash their hands with water and soap and they don't have running water, obviously the measure it will not be effective if you do not adjust this to those populations. And the problem with the approach to vulnerability has often been, and still is, related to the individual and the biological attributes of the focus and focus on the risk factors and on mortality. So when we talk about vulnerability, people say, oh, the elderly, or the Afro-Americans, or the indigenous populations. They're looking at all the people with disabilities as a group, as a biological condition, more than the circumstances in which people live. I'm going to talk again a little bit more about that. So we need to go beyond this biomedical individual characteristics, as I already mentioned, and take into account the social conditions and differentiate risk from vulnerability. And everybody in occupational health is particularly versed in that, of course. So then we made this, try to capture some of those vulnerabilities and COVID. And that's where we're going to get to our workers, because the outer layer, we're looking at the structural, socioeconomic, political inequalities that were pre-existing, that were already there before COVID. Workers in the informal economy, living in precarious conditions, migrant workers, they are worse off now due to the pandemic. So that's one layer, one group of people that have now situations that are worse. Then you have a second layer of vulnerability where we see an increased risk of exposure to COVID due to the difficulties in complying with the recommended measures. And this can be because the people are essential workers and they have to go out and they have to use transport, etc., etc. But it can also be people in the informal economy. I already mentioned the numbers for this region, where staying at home is not an option. When you have to go out, you have no social protection and you have a family to feed. So these barriers to the implementation of the measures and the adherence is very important there. And then we see also very particular situations. If you look at the US, for example, the Latino workers in California are about 40% of the workers. Actually, 80% of the agricultural workers are Latino. So what happened already in May last year, a year ago, more than 80% of the hospitalized people were Latinos. And obviously that was related to their work and their working conditions. and their employment conditions. So then you have this third layer of vulnerability where you see adverse effects of the impact and the impact of the measures like physical distancing on the population, which gives an additional burden of mortality, morbidity. Of course, we all know the difficulties of not having access to the care, health services overwhelmed, people, not getting any care for chronic diseases, etc. But you also see here populations who live in slums, in very unhealthy conditions, in situations with crowding. Somebody said it earlier, if you live in a nice house like we do or like I do, it's one thing to stay at home. But if you live in a room 3 by 3 with a whole family, everybody's home, everybody's competing for the internet, and there might even be some addictions, etc. The violence that we have seen and the mental health problems that we've seen are just huge. So that is another big issue. And then, of course, and this is the traditional one where we hear most about, the increased risk of mortality due to comorbidities, obesity, hypertension, overweight, etc. So we think this is important and helpful to also put, very clearly why employment and labor is so important. So if you look at what are those drivers, I mentioned them all, but just it's the labor, the different categories of workers, informal economy, self-employed, those with precarious contracts, without social security, without social protection, essential workers. These have been the ones at the forefront, and where really we have seen a lot of the cases and driving the pandemic. Housing, people living in inadequate housing, crowded spaces, different kind of institutions, long-term care, been a huge thing, deprived of liberty in the castles, etc. Social exclusion, migrants, people living with disability, indigenous populations, Afro-descendants, homeless. This is another driver, and these are the populations then living in situation of vulnerability. And the other populations are related to social support and the burden of care, single parents, women head of households, people living alone, etc. Loneliness has been a huge issue. And then in some territories that have been particularly complicated, where the people living in those territories and these informal urban settlements, remote urban areas, were very much at risk. Now, this is a slide from the US, and I thought this is important because I'm always struggling, with the lens the US uses for inequity is very much, and of course, this is the moment where this all becomes very, very difficult, very, very relevant. It's the race lens, which is obviously extremely important. But even if you look here, at the differences in cases, hospitalization, and deaths between American Indian, Asian, Black or Afro-American, and Hispanic, you see that American Indian, for example, this is compared, of course, with the white population, have more cases, hospitalization, and deaths. And this holds for almost all the population groups. Hispanic and Black, very similar here. So race and ethnicity are those risk markers for other underlying conditions that impact health, now including the socioeconomic status, access to healthcare, and increased exposure to the virus due to occupation, frontline workers, essential workers, critical infrastructure workers, etc. So this analysis done by the CDC, I think, is very, very insightful, because it looks not only, at ethnicity, but it also looks at those underlying conditions. Another interesting example, again from the US, is, and we all know the huge amount of outbreaks. This is already old. There are now more in over 700 meat packing and food processing plants in the US. We have seen mass layoff in agricultural workers. Many workers are afraid of testing for COVID, since a positive test may mean permanent job loss. Again, the systematic barriers to testing and for prevention measures and medical care are very, very persistent. And OSHA then only of course, provided guidance, but not necessarily requirements for the employers. And some employers have refused to offer testing or threatened retaliation if workers seek testing. And also workers employed by farm labor contractors may have been less likely to receive PPE from their employer. Then we have seen also overcrowded substandard housing conditions, already mentioned that, obviously makes quarantining and social distancing, even if you are positive, extremely difficult. And then extremely low annual incomes, a widespread lack of access to health insurance limits health care seeking behavior among agricultural workers, etc. So these are some cases, not only in Latin America, but also here in the US. Of course, the healthcare workers have been bearing the brunt of the COVID burden. And globally, we see that the health workers represent less than 3% of the population in most countries, 2% in almost all low and middle income countries, but around almost 15% of the COVID cases reported to WHO are among those healthcare workers. So I'm not going to go into all the details here. You also see the psychological toll that the stress of the pandemic has caused, particularly also, more demanding, exacerbated this already demanding work environment, fears for personal family safety. 1 in 4 frontline health workers have reported symptoms of depression and anxiety during the COVID outbreak. And even, we were saying, these were our heroes, but there are also rising levels of discrimination, verbal harassment, and physical violence in their daily lives. The region of the Americas has the highest number of healthcare workers infected in the world. In September last year, this is already 7 months ago, 570,000 health workers had been infected and more than 2,500 died. And as to speak with the words of my director, no other group has felt the pandemic more acutely than the very men and women who make up our health workforce. In the US and Mexico, which have some of the highest case counts in the world, health workers represent 1 in every 7th case. And these 2 countries account for nearly 85% of all COVID deaths among healthcare workers in the region. Very dramatic numbers. And here I'm going to tell a story. It's a story from Peru. Because the number is a number, but these are the stories not of the people. So Juan, who comes from an indigenous village in the Andes in Peru, is married to Julia, and he comes to Lima, to the capital, to seek work in the beginning of 2019. They come with their 2 children, find a job, find better opportunities. He works in construction. He finds some loose jobs, no social security. And Julia finds a job as a housekeeper for a wealthy family, and their combined income is just enough to cover the basics. Then COVID hits. The government takes very strict quarantine measures. Julia loses her job. Juan cannot work from home. Only 25% of the people in this region in Latin America can work from home. But the construction continues, and he goes out to find work, but of course it's very difficult. The kids stay home from school, they lose their school breakfast, their lunch, and they have difficulties with teleschooling, poor internet, only 1 cell phone in the house, no computer. They're having difficulties paying the rent. The landlord has been around several times to ask for the rent. Julia goes to the market by bus almost every day, because she doesn't have a fridge. So she needs to go get her vegetables because they can't keep them in the house. And she's, of course, very afraid of getting COVID. If one of them gets COVID, they won't have the space in the house to self-quarantine, nor will they have access to healthcare. They don't have health insurance. Hand washing is difficult. The water only comes twice a week and is used for essentials such as cooking. The government is promising financial support. It's been slow to come. The government actually by now has had, I think, 5 or 6 health ministers in this period of 1 year, just to also look at the political impact there. Neighbors have organized, the communities have organized wherever they could in solidarity. Many friends and family members have died, and the health system is collapsing. It's only 2021, and just a few vaccines are starting to drip in. So COVID-19 and the public health measures to control the pandemic have severe macroeconomic consequences, but they also cause serious suffering, particularly by the most disadvantaged. So we developed a guide to look, particularly ask, based on those questions we asked earlier, why have we not been more effective, and what do we need to do to be more effective in the application of those public health measures? Here is the link. I really recommend you to look at that. And we're also going to do a call for application. So stay tuned, as they say. Now, going to the last bit of my presentation. So if you look at, this is some World Bank and IMF data at what is expected for the coming years. It says a return to sustained slow growth. But this is an optimistic picture, and this is assuming that everybody will, in a reasonable time frame, get a vaccine. But still, an expected 5 to 10 years to make up for lost economic gains in Latin America are going to be needed. And again, it's highly dependent on the control of COVID, and it's assuming that it's going to be controlled. That's what this is based on. And we know the North is doing pretty well. Europe is doing pretty well with the vaccines, but the South is not doing so well. And even despite COVAX, etc., and all the efforts that are being made. So, but the outlook is extremely unpredictable. And it's even, some are saying that we might look again at another lost decade like we had in the 1980s. So the question will be, is there going to be sustained and inclusive economic growth? So this picture is important when we talk about occupational health, the new opportunity that everybody is talking about. Of course, we all know, everybody in this field knows that occupational health has been neglected for way too long. The only ones who benefit a bit of occupational health have been those in the formal economy and the larger workplaces. So what does this mean then in a region with over 50% informal economy, many with precarious jobs and no protection? So we've seen workers who are at the forefront, determined by employment conditions, working conditions, access to care, migratory status, living conditions. So it's all out there. Everybody can see it. Everybody's talking about it now. So this supposed to be an opportunity for us, isn't it? And at the same time, if you look at the health system, there's also a chronic lack of investment in public health and public health services. If you look at how public health failed at the beginning of the pandemic, it's just dramatic. We couldn't even do, test, track, trace, quarantine. And that's why we had to go so quickly into this much more dramatic measures, like telling everybody to stay home and closing all the non-essential businesses. Primary healthcare basically doesn't exist in many countries. We're talking about it since 78, since Alma-Ata, but really primary healthcare like it's intended to be, is very, very rare. Even first line of care is weak and neglected. And even our hospital capacity has proven insufficient because of the failure of sound public health, as I mentioned earlier. And so our ICU beds, etc., were not sufficient. Now, there's, of course, when we talk about investing in health, there is a big risk that countries say, no, we have to scale up that hospital capacity, put more ICU, put more specialized nurses, because that's where we failed. And that's a big risk. It's very likely that countries try to say, okay, we need to strengthen that instead of strengthening the basic public health and linked to that, the basic occupational health. There's many barriers to access to health services, both on the supply side, on the demand side. That's another presentation. I'm not going to go into that. So coming back to that opportunity. So it might be an opportunity for workers' health, and workers' health is essential for building forward better instead of building back. But then we need to really address those employment conditions. We need to look at income. We need to look at social protection, social security, paid sick leave, unemployment benefits. We need to look, of course, at the working conditions, the high risks, not only for healthcare workers, but also construction, transportation, agriculture, etc. We need to look at access to healthcare. We need to look at what happens with migrant workers. We need to look at living conditions. So there's a huge agenda in front of us. And who is going to take care of the agenda? This opportunity is only an opportunity if there is a paradigm shift. if the principles of inclusion, of equity, leaving no one behind, are really kept centrally in this recovery agenda, if the governments really keep their words and translate declaration into action, if sufficient resources are made available from, to public health, to workers' health, etc., if workers are involved in agenda setting, and if intersectoral action really becomes a reality. There's a lot of ifs there. So I'm leaving you with a few questions, and took, sorry, a few minutes longer, but the questions for you, and maybe we can talk a bit about that. So how can we take advantage of this opportunity? How can we make sure that that is not just because an opportunity, this is a window of opportunity. It's not going to be with us forever. How are we going to reconstruct in a more equitable way? How can we use what we learned from the pandemic to move and to build that new society that we need? Where is this drive for change going to come from? Is it the workers? Is it where is it the government? Is it the community? And what can we as the OSH community do? What do we need to do to really, take this opportunity and make this into a reality? So I'm leaving us with more questions than answers, but I think this is a very important moment and we cannot waste it. Thank you so much.
Thank you, Dr. Gary, for your excellent presentation. And I was very sensitized about what many things that you told us. And it's so similar to millions of families around the world, and especially in Brazil. And I agree that it's a big opportunity for us to take care more for the vulnerable people, and especially for vulnerable workers. Thank you a lot for your presentation. So now we will have the second speaker, Dr. Fabrício Menegon. He is graduated in physical education at State University of Maringá in Brazil. His master in physiotherapy, doctor in public health, associate professor at the Department of Public Health at Federal University of Santa Catarina. His research fields are occupational health, ergonomics, and epidemiology. He develops research and projects on ergonomic intervention, working condition, occupational health disease process, occupational epidemiology, policies and programs in occupational health, mental health, and work. So thank you, Dr. Menegon, for coming, and the word is with you.
Well, like Dr. Cruvinel said, I would like to thank Dr. Cruvinel, which I call by the name of Vanessa, because we are becoming friends, and she's Brazilian too. So thank you, Vanessa, for this invitation. She was one of the persons who make the contact with WHWB and the arrangements for my participation here. So thank you very much for this opportunity. Also, I would like to thank Workplace Health Without Borders for this opportunity also, and for having me here. Well, I'm from Federal University of Santa Catarina, as you see on your screen. We are in Brazil. I would like to share with you some of my thoughts and concerns about COVID-19 pandemic in Brazil and its impact to the workers. So let's begin. So where we are in the world, that is a basic question, but here is Brazil. Here is the map of where Florianopolis is located. So the red square in the map shows the place where is Florianopolis, and you can see also the geographical area of our city. So all the names that you see on your screen are the names of the beaches here. One more beautiful than another, okay? Just for see a little for you, just to say something for you. Well, this is my university, the Federal University of Santa Catarina. The main campus here is located in Florianopolis, and we have another 4 units distributed in other cities in the state of Santa Catarina. We are a quite young institution considering Brazil's history of high institutions. So we have only 60 years old, and we have almost 4,000 students. We are the 8th university in Brazil and the 23rd in Latin America. This is a rank that was delivered to us in 2021. There are many ranks for Brazilian universities, as you know, and we have many undergraduate and graduate programs in all fields areas. So, okay, the topics in this presentation I would like to cover. We will see an overview of COVID-19 pandemic in Brazil and its impacts in health conditions, work and economy, what is considered essential work in Brazil during COVID-19, and aspects of informal work in Brazil, the income support for workers in Brazil during COVID-19. So these are the main topics. I'll try to discuss this with you in my presentation. Well, as you know, you must be following the news around the world and the image of Brazil in the international press. So this is not a good screen. In fact, I would like to show to you, but despite the effects, the truth is that we are experiencing many problems due to the lack of strategic governmental alignment to face the pandemic. This is really, really real here. In addition, there is an influx of misinformation and fake news spread across the country, which compromises engagement and consequently the effectiveness of science-based strategies to deal with the pandemic. Unfortunately, it is true that the president has not contributed to improving this scenario, both in the public manifestations he makes and in the management of the crisis in Brazil. So we are struggling with this right now. Well, about the current scenario of the pandemic in Brazil is as follows. We have reached 375,000 deaths on April 19. Our worst moment occurred on April 6, when we have registered more than 4,000 deaths in a single day, as you can see on the screen. Currently, there are more than 3,000 deaths per day in Brazil, and some states have already reported higher rates of deaths than births over the months. So we are experiencing a constant tension between those who are against science-based action and those who seek the control, the increase in cases and deaths with measures that are known to be effective. Many actions of a negationist character have occurred and still do. These are behaviors that are not supported by science, of course, but are conducted with an ideological bias or driven by political interests and private groups. The next slide shows, as you can see, the daily mortality rate per million inhabitants are much higher in Brazil. This is Brazil than in other economically developed countries. The daily death rate for COVID-19 in Brazil today is 3.2 times higher than in France and almost 7 times higher than in the USA. So it's a big problem here. Also, in addition to high mortality, the number of people with post-COVID-19 sequelae is also worrying. There are respiratory, neurological, and cognitive damages, just to mention a few examples. And this has negative consequences for the daily life and workability of these people. Brazil has not yet structured a strategy to deal with the post-COVID-19 sequelae. Some isolated actions are underway in large cities, most of them in private health institutions, such as physiotherapy clinics, but we not have governmental policy for this. The vaccination campaigns is still very timid here. We are one of the countries that most apply doses of the vaccine in the world, but regarding the size of our population, we have done very little, even with the large installed capacity for vaccination in the Unified Health System, our SUS. I don't think that you know this data, but there are 38,000 vaccination units in the Unified Health System in Brazil. With this considerable structure, we are able to vaccinate 1 million people a day or more. We have done this in the 80s and in the 90s. In addition to the low vaccination rate of the population, we have experienced a collapse in the intensive care units and low capacity for health surveillance in primary health care. These elements are not the only ones, but they contribute significantly to the current stage of the pandemic in Brazil. The next slide. So the vaccination in Brazil, as I said, goes slowly. Less than 5% of the population has already been fully immunized. In Brazil, only 2 vaccines are being applied. The Oxford AstraZeneca, which will be produced by Fiocruz, our institutional research agency in public health, and the Coronavac, which will be produced by the Butantan Institute in partnership with the Chinese laboratory Sinovac. These are the only 2 vaccines we already have in Brazil being available for the population. It is important to mention that the Brazilian government took a long time to decide to purchase vaccines, even though it knew then that Brazilian institutions were organizing themselves to produce them. For information, the pharmaceutical company Pfizer offered 70 million doses to the Brazilian government on August 15 in 2020, last year, with delivery scheduled for December 20. It is estimated that about 3 million Brazilians could have already been immunized with the doses lost from the Pfizer vaccine. So it's a really big problem here. To date, many jobs, both formal and informal, have been lost. We already live with phases of price increase, inflation, people returning to the condition of extreme poverty. Dr. Eichmann said in her presentation how Latin America are facing this, so Brazil is not different. Starving and other social consequences are being observed here as well. Well, this data shows the worst scenario for the last quarter of the year and means that in 1 year, 2.3 million people were unemployed in Brazil from the end of 2019 to the end of 2020. 2.3 million people became unemployed in Brazil. There are currently, as you can see on the screen, this is a governmental institute, so it's the official data of the government in Brazil. 14.2 million people in Brazil are unemployed today. Other data from this research are important to highlight. We have also we have 14 million people unemployed in Brazil. And well, some other informations are important. For example, unemployment rate stood at 14.2%, as I said, record number. This is the record number of unemployed, 14.3 million people in Brazil nowadays. The number of persons with some kind of work grew by 2%, but we don't know where are these people, if they are formal workers or informal workers, and reached 86 million people, which is a good news for sure. Only 48.7% of workforce. In Brazil, we consider workforce people who have 14 years old or more, and they are only 48% of these people were really working. Informal workers in Brazil were 39.7% of our workforce, and there's not work opportunity for 32.4 million people, and we have almost 6 million people who gave up to look for work because they have no expectation to find a job. Okay, so this is a very, very, very big problem. Well, about the essential workers, I think we are all essential workers. Okay, but however, a presidential decree was published during the pandemic that classifies who among the workers are most essential. Nowadays, there are 53 related essential works, essential activities. This decree guides which activities cannot be interrupted in the event of a lockdown, for example. The problem is that after the first publication, another 3 republishments of this decree have already been carried out, which included all other essential activities without clear criteria for this inclusion. States and the federal district also can expand the list of essential activities. So as you can see on the screen, there are some kind of essential activities and they range from healthcare to broadcasting sounds and images, passing through cargo transportation, scientific and laboratory research related to the pandemic, and collection, treatment, and distribution of water. So we can say that all the activities that it's essential to keep moving forward, to keep the world moving forward, maybe are the essential activities. But there's a lot of there is less criteria than it should have been to determine who are the essential workers in Brazil. We have lots of pressure from some economic sectors to become an essential activity. In case of a lockdown, they were obligated to close. They will keep working for free or working in uninterrupted. Well, and about the informal workers, well, who are them? They are street vendors, they are food delivery, they are waste pickers, they are app drivers, and many other work activities. There are many work activities in Brazil who are considered informal workers. Another important about this is the profile of the informal work in Brazil. So I bring to you some of this profile. Almost 50% of informal workers in Brazil are Black people. 34.5% are white people. 62.4% have low education levels or are illiterate. 22% have higher education also. Black people have lower income than white people, even with the same education level. Most frequently works include housekeeping, agriculture, construction, transport, and food, as you said in the last image. Another data is important to say here is that most of the workforce in informal work in Brazil are women, okay? Lots of women are working in informal work in Brazil, and many of them are the leaders of the family. So this is a double problem, as we can see in the future. So about the income, what income support are informal workers getting here? Well, on April 6 in 2020, Brazilian government started paying income support to informal workers and people in socioeconomic vulnerability due to the COVID-19 pandemic. I estimated the value of Brazilian income, as you can see on the slide, the income support in US dollars, considering the exchange rate here, practice here in Brazil on April 19. I think it's a way that people around the world can understand the amount of money the income support here in Brazil are being delivered. So income support varied from $108 to $218 until December 20 last year, and it was paid to 66 million people, which represents 31.3% of the population. But now, on April 21, it will vary from $27 to $68. You are not reading wrong. This is the value, okay? $27 to $68. And will be paid to 40 million people, or 18.9% of the population. So it will be paid. It will pay a less amount of money to a less amount of people. Okay. So this 26 million people will no longer get income support in 2021. Well, the government's claim for this change in the number of people covered by income support is that there are no financial resources for all, and the rules for obtaining income support became stricter, which limited access for a considerable portion of the population. Well, the question is that enough? The most obvious answer is no. But take a look at this curious comparison between Brazilian and American income support. It is in Portuguese, but I made the art to translate the news, and this is the translation. Bolsonaro's income support pays 7 Big Macs, and Biden's income support pays 247 Big Macs, or 35 times more. What this means? Well, the English magazine, The Economist, well, it could be considered some kind of joke, but no, the English magazine, The Economist, uses Big Mac as a basic product for comparing purchasing power in different countries, as this snack is sold almost everywhere in the world. Regardless of the comparison, it is important to know that 247 Big Macs are equivalent to 8.2 meals a day for 30 days, okay? For the Brazilian case, 7 Big Macs are equivalent to 0.2 meals per day during the same period. So it not supports, it not delivers food, it not delivers dignity to the people, as you will see further in this presentation. But it's what we have today. And it's not simple to get. As you can see, in addition to the unavailability for all, those who obtained the income have to face long lines at the doors of the banks to confirm whether the money was available. This must be resolved in this new phase, I hope, but we have seen lots of these scenes in Brazil last year. Okay. Well, these slides, I'm going to the end of my presentation, and this slides shows income support during the COVID-19 pandemic until December 28 last year. So the available data show that the income support was paid until the end of the last year in Brazil. Here we see that in comparisons with other countries, the Brazilian income support did not reach 50% of the country's population. In developed countries like USA, Canada, Japan, and much part of Europe, we observed that the proportion of people contemplated by, was higher. In Latin America, Chile and Uruguay also covered more than 50% of their population with income support. Okay, but so this is for we have some kind of idea of comparing Brazilians' income support with other countries in the world. And in this next slide, we see that as of January 1, or the first day of this year, we know that Brazil has ceased the pay to income support, differently from what other developed or developing countries have done. Even in Latin America, other countries continue to provide income support for their population. This was the case in Paraguay, in Bolivia, in Venezuela, in Ecuador, and other countries, as you can see on the screen. The payment of income support in Brazil was only resumed this week on April 17, or it was almost 4 months without any income support to the most needy. Well, but someone may be asking, what is the real impact that income support has on the income of informal workers? Well, on this slide, we can see the results of a Brazilian study that measured this. Realize that in the lower strata of income loss with the pandemic, there are several work activities that are carried out by informal workers here. The loss of income without this emergency support can vary between 19% and 42% in the main informal activities. I'm sure you cannot read what is written in the screen, and I apologize by the quality of the image, but I can maybe translate for you some of these categories. So in the lower line here, in the lower category here, we have self-manufacture people, we have the artists, we have the sellers, in the street sellers, we have here people who works in construction, we have here the domestic employees, the housekeeping people, and we have here people who delivers food with motorcycle. So they are the lower strata of the loss of income without the support of this income support. The next slide shows you the losses and gains with and without income support. So even more, when you look at how much this represents loss of income compared to formal workers, we see that informal workers can have something like 2.5 more loss of income than formal workers. On the other hand, gains from income support complement up to 50%, as you can see here, on the income of informal workers. So income support really plays an important role on economic balance to informal workers, sorry. So it is now not only necessary, it can save lives. It can make the difference between some kind of dignity or indignity, okay? Well, but we are not only bad news. The good news is that some states and capital cities have also made their own income support available. At least 18 Brazilian states and the federal district and 16 capital cities have done this. Sometimes the value of the state income support is greater than the federal one. In other cases, people may receive both income. There are conditions for that, of course. There were also programs to support small and micro enterprises. Anyway, the big barrier is still the bureaucracy to access the income support. In some cases, the demands are so great that they discourage small business owners from asking for income support. This is another kind of problem here in Brazil, the bureaucracy to achieve governmental lines of financial, okay? So what we should expect for the next years, I think Dr. Eichmann delivered to us a great scenario for Latin America, and Brazilian scenario is not so different. The prospects for economic growth for Brazil are positive, but very challenging considering our current economic context and the COVID-19 pandemic. Brazilian GDP in 2020 decreased by less 4.1%. And the most encouraging estimates say that GDP may grow 3% in 2021 and 2.8% in 2022. Well, the prospects for economic growth for Brazil are positive, but very challenging, considering our current economic context and the COVID-19 pandemic. Well, Brazilian GDP in I repeat this. Well, sorry. Well, the Brazilian government placed much hope on the impact of vaccination against COVID-19 for the economic recovery. But for that, we need to have vaccines for everyone, available for everyone, and we still don't have it, okay? So it's a matter of priority. Another strategic priority is to ensure that income, whether emergency or not, reaches those most in need. The reduction of inequalities, which in Brazil are extreme, involves the generation and distribution of income for all in order to guarantee dignity. In terms of social inequality, economic analysis show that the COVID-19 pandemic placed us at levels of 2004, like Dr. Eichmann also said, but in Brazil, it's a little worse scenario. We have regressed 17 years in social development. How long will it take to us to recover this? Well, we still don't know. Okay, and to conclude my presentation, I bring to you a part of the lyrics of a Brazilian song from the 80s. It's in Portuguese, but also it's in English, and it says, "Until when to wait?" From the band Plebe Hood. I think Vanessa also know this band. It's from Brasilia, and it's very, very good. Okay. I did a free translation of this part of the lyric. I hope it was as appropriate as possible. And she said, with so much wealth out there, where is it? Where is your part? Until when to wait? The commoners kneel waiting for God's help. Some kind of sensation we have here in Brazil is that people are waiting for some kind of divine help, okay? Because they don't see, in any stracts of the government, some kind of help that really brings them to the light, move them from the condition they are facing today. Okay. So my dears, thank you very much. Once again, I would like to thank the WHWB committee for this opportunity. Here's my contact. Thank you very much for your attention. Hope to see you in Flesh and Bone sometime. Thank you.